Pregnancy is a remarkable journey, and each one is a unique adventure. Not every mother will feel the same symptoms or progress at the same pace, but the final weeks are always an exciting whirlwind. During this time, the baby packs on those last few ounces of body fat, and as they grow, the mother's belly expands. This growth often leads to increased discomfort, particularly in the lower back, pelvis, and abdomen. As the baby prepares for birth, they'll likely change positions, shifting around or even rotating within the womb. Most babies settle into a head-down position, nestled in the mother's pelvis, ready for their grand entrance. This head-first position, known as the cephalic presentation, is ideal for a vaginal delivery, easing pressure on the mother's diaphragm and making breathing easier, though it often means more bathroom trips due to the added pressure on the bladder. Some babies, however, may decide to stay breech, feet first, keeping everyone on their toes until the final moment. In these last weeks, the baby's lungs mature rapidly, producing a vital substance that will help them breathe air after birth. The baby might even practice breathing, with little diaphragm and chest movements mimicking what they'll soon do in the real world. For the mother, a mix of emotions hits full force: excitement, anxiety, nervous anticipation, all part of the journey toward parenthood. Many moms experience a surge of energy, famously known as the nesting instinct, where they might feel an overwhelming urge to clean, organize, and prepare their space for the little one's arrival. Meanwhile, the body itself is in preparation mode. Braxton Hicks contractions, the so-called practice contractions, start ramping up. Though they might have begun as early as the second trimester, they become more noticeable in these final weeks. But once real labor begins, the true contractions arrive in full force, strong, rhythmic, and consistent, slowly opening the cervix in preparation for the baby's descent. Then, there's the big moment, the water breaking. It might happen on its own, or a healthcare provider may assist with a simple procedure if needed. When the time comes, relaxin, a hormone, works its magic, loosening the ligaments and tissues in the pelvic area, making the vaginal walls more flexible. The cervix softens and opens up, dilating to 10 centimeters, signaling that it's time for the mother to start pushing. The pushing stage can be intense. The mother uses all her strength to help the baby move down the birth canal. As the baby's head crowns, the vaginal walls stretch to accommodate its size. Sometimes, to avoid tearing, a healthcare provider may perform an episiotomy, but this is only done when necessary. Soon, the baby's head emerges, followed by the rest of the body, and in that triumphant moment, the baby enters the world. Their lungs, now ready for action, begin to function as they take their first breath. The umbilical cord is clamped and cut, officially separating the baby from the placenta. Even after the baby's birth, the mother's body continues working as she delivers the placenta, marking the final stage of labor. Though this stage is shorter and less intense, it's the last step in an extraordinary journey. And once it's over, all focus shifts to the newborn as healthcare providers check vital signs and ensure that both mom and baby are doing well. It's a moment of pure magic, where the whole world changes in an instant.